Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see another classification, that is a classification number 35, Anti-Cancer drugs or Anti-Neoplastic drugs part 2. In the previous classification part we have seen the Anti-Cancer drug part 1 classification, that is a cytotoxic drug part 1. Now we are going to see cytotoxic drug part 2. This classification is very important for your GPAT Niper Drug Inspector and Pharmacist exam. So I would like to request you, please watch this video until end. My dear students, we have already seen 34 classification videos. If anybody has not seen previous classification videos, please go in the channel's playlist and watch all the classification videos, because they are really important for your upcoming GPAT Niper Drug Inspector and Government Pharmacist exam. And believe me, lot of MCQs they are going to be covered just by watching these classification videos, because in those videos I have not only explained you the classification but also I have told you some important points regarding the all classes. So please go and watch all the videos from the channel's playlist. My dear students, first of all I would like to revise you different classes of the anti-cancer drugs. So what are the different classes of anti-cancer drugs? So first class is nothing but the alkylating agents. Alkylating agents, they will do alkalization, they will cause methylation or ethylation at the different nucleotide bases, particularly नाइट्रोजन 7 of guanosine रेसिड्यू. जो डीएनए में न्यूक्लियोटाइड बेसिस होते हैं प्यूरिन पिरिमिडिन्स, उसमें जो guanosine रेसिड्यू होता है particularly 7th नाइट्रोजन, उसके ऊपर ये अल्कलाइजेशन करेंगे. कौन? So these drugs, nitrogen mustard, ethylene imines, alkyl sulfonate, nitrosourea and triazine. So in the alkylating agents you have different classes. So alkylating agents, that is a first class, that is a main heading, alkylating agents. In that you have nitrogen mustards. So nitrogen mustards. So drugs like these, meclorethamine, then cyclophosphamide, ephosphamide, chlorambucil and melphalan. So these are the drugs, they are known as a nitrogen mustards. They are known as a nitrogen mustards. So they will cause generation of one radical, that is a methyl radical or ethyl radical, which will alkylate the DNA bases. So meclorethamine, they can cause vasculitis. Cyclophosphamide can cause hemorrhagic cystosis. The drug used in the hemorrhagic cystosis is nothing but the mesna. Then chlorambucil has a neurotoxicity. Melphalan is also having neurotoxicity. Then ethylene imines. So first class in the alkylating agent nitrogen mustard. Second class ethylene imines. So example is thiotepa. Then third class is alkyl sulfonate. Busulfan is the drug. Now this drug is a highly lipid soluble. It can cross the blood-brain barrier. It is used in the glial tumors. Nervous tumor में use किया जाता है. Brain tumors में use किया जाता है. Then nitrosourea, in that you have carmustine, lomustine and streptozocin. So out of that, streptozocin is a antibiotic obtained from streptococci, remember. Then triazine derivative, in that you have dicarbazine. We have already seen this classification, but I would like to repeat it. Now anti-metabolite. So anti-metabolite, they are known as a phase specific drug. So alkylating agent, they are known as a cell cycle non-specific drug. So alkylating agents, they will be effective in the both actively dividing cells as well as resting cells. So dormant cell के ऊपर भी act करेंगे, जहाँ पे active cell division चल रहा है वहाँ पे भी alkylating agent act. They are known as a cell cycle non-specific drug. Antimetabolites, they are known as a cell cycle specific drug, and they are only effective in the where there is an active dividation of cell. So in that you have folate antagonists like methotrexate. We have seen about the methotrexate. It can cause bone marrow suppression, alopecia, neutropenia, aplastic anemia, etc. etc. So in case of methotrexate toxicity, you have to use folinic acid or leucovorin. That is a leucovorin is nothing but the N-tail formyl folic acid. So that is known as a leucovorin rescue. Then purine antagonist, in that you have purine antagonist 6-mercaptopurine, thiogonine, 6-mercaptopurine, thiogonine, azathioprine and pentostatin, fludarabine and cladribine. Now pyrimidine antagonist, in that you have thioflurouracil, fluxuridine, citarabine. Citarabine is known as cytosine arabinoside, gemcitabine. Anti-cancer antibiotic we are going to see today. Actinomycin, also known as actinomycin, daunorubicin, doxorubicin, bleomycin, mitomycin C, and mithramycin. Then plant products, in that you have epipodophylotoxin, in that etoposide and teniposide. Camphothecans, in that you have topotecan and irinotecan. Taxanes में आएगा आपका paclitaxel, docetaxel. Vinca alkaloids, in that you have vincristine, vinblastine, and vinorelbine. Miscellaneous, in that you are going to have procarbazine, mitotone, L-asparginase. L-asparginase is nothing but the enzyme. Then cisplatin, interferon alpha, and imatinib. Hormones and their antagonist, we are going to see a different separate classification on this. Then we are going to see a different classification on the targeted drugs. So we are just seeing cytotoxic drug. We have finished up class first. Now today we are going to see second class. Next video on will be on the targeted anti-cancer drugs, and after that last video on the hormonal anti-cancer drugs. So in the hormones and their antagonists, glucocorticoid, androgen, anti-androgens, estrogen, anti-estrogen, progestin, aromatase inhibitor, etc. Anti-cancer drugs part 2, that is a cytotoxic drug. Anti-cancer drugs part 2, cytotoxic drug. So first class in that, those drugs which damage the microtubule during the माइटोसिस. जब माइटोसिस होता है, सेल डिवीजन होता है, उसमें जो माइक्रोट्यूबुल बनता है, सेपरेशन ऑफ क्रोमोसोम्स, फॉर्मेशन ऑफ स्पिंडल, एंड देन सेपरेशन ऑफ टू न्यूक्लियस. Formation of microtubule is damaged by different classes of drug. For example, vinca alkaloids. It is vinca alkaloids. They are nothing but the indole alkaloids obtained from vinca plant, Catharanthus roseus family, Acanthaceae. Right. So in that, vincristine is there, which is also known as oncovin. Vinblastine is there. Vinorelbine is there. So remember, vin is the common. Vinca alkaloids में vin common होगा. Vincristine, vinblastine, and vinorelbine. So vincristine is also known as oncovin. Remember, oncovin. So we are going to see the adverse effect and important points in upcoming slides. Microtubule damaging agent. Second class is nothing but the taxanes. So in that you have paclitaxel, docetaxel. So we are going to see detail about this. Then third one is the istramustine. Now istramustine is nothing but the, you can see istra is the term for estradiol, and mustine is the term for your nitrogen urea or alkylating agent. Istramustine is a combination of ethyl estradiol, your alkylating agent. So it is a combination of estradiol plus alkylating agent. So second class is nothing but the topoisomerase 2 inhibitor. So topoisomerase 2 inhibitor, they are nothing but the etoposides. Etoposides कहाँ से आता है? It is also again a plant product. Then third class in the cytotoxic drug group, topoisomerase 1 inhibitor. So in that you have tecans, topotecan and irinotecan. All the tecan derivative, they are topoisomerase 1 inhibitor. Topoisomerase 2 inhibitors are nothing but the etoposides, or you can say podophylotoxins. So etoposides are nothing but they are obtained from podophyllum. So it is nothing but a glycoside which is obtained from podophyllum plant, etoposide. They are the glycosides. Now anti-cancer antibiotics. So anti-cancer antibiotics. In that you are going to have these drugs. Anti-cancer antibiotics. So actinomycin D, doxorubicin, daunorubicin, then epirubicin, mitoxantrone, bleomycin and mitomycin C. Now इसको याद कैसे रखना है? Actinomycin D, doxorubicin, daunorubicin, epirubicin, mitoxantrone, bleomycin and mitomycin C. तो यहाँ पे याद रखना है A B C D E. I will explain this. A for actinomycin, D, B for bleomycin, C for mitomycin C, D for doxorubicin and daunorubicin, E for epirubicin and mito. A B C D E mito. So you can remember this antibiotics, anti-cancer antibiotics by one trick. A B C D E mito. A for actinomycin D, B for bleomycin, C for mitomycin C, then D for doxorubicin, daunorubicin, E for epirubicin and mito for mitoxantrone. Okay? So you can remember this anti-cancer antibiotics by one trick known as a ABCDE जो लिखा है आपने पेपर पे उसको मिटाओ. In that cytotoxic drug, last class is nothing but the miscellaneous. So in the miscellaneous you have hydroxyurea, L-asparginase, tretinoin and arsenic trioxide. Hydroxyurea, L-asparginase, tretinoin and arsenic trioxide. So hydroxyurea, L-asparginase is the enzyme, tretinoin is nothing but the vitamin A derivative, then arsenic trioxide. So these are the cytotoxic drug class 2. So again I would like to revise you in the cytotoxic drug part 2. फर्स्ट क्लास क्या होता है माइक्रोट्यूबुल डैमेजिंग एजेंट, इसमें पिंक अल्कोलाइड्स आता है, टैक्सेंस आता है एंड इस्टामास्टिन आता है. सेकंड क्लास आता है साइटोटॉक्सिक ड्रग पार्ट 2 में टोपोआइसोमरेज 2 इनहिबिटर, इसमें आता है पोडोपाइलोटॉक्सिन, दे आर नथिंग बट द ग्लाइकोसाइड ऑब्टेन्ड फ्रॉम पोडोपाइलम इटोपोसाइट्स. थर्ड आता है टोपोआइसोमरेज 2 इनहिबिटर, उसमें आता है टोपोटिकन एंड इरिनोटिकन. So taxanes, so these are nothing but the taxane derivative, taxanes. और एंटी कैंसर एंटीबायोटिक में आता है ए बी सी डी ई मिटो, मिटो ए बी सी डी या फिर ए बी सी डी मिटो. ए फॉर एक्टिनोमाइसिन डी, बी फॉर ब्लियोमाइसिन, सी फॉर मिटोमाइसिन सी, डी फॉर डॉक्सोरोबिसिन डाउनरोबिसिन एंड मिटो फॉर मिटोजेंट्रोम. और मिसलेनियस में आता है आपका हाइड्रोक्सियूरिया, एस्परजिन, एस्परजिनेज, एल एस्परजिनेज इज अ एंजाइम, then tretinoin and arsenic trioxide. So these are the anti-cancer drug part 2 or cytotoxic drug part 2. Now we'll see the important points from these. So anti-cancer drug mechanism of action and specific adverse effect. Anti-cancer drug mechanism and adverse effect. So Vinca alkaloids, they binds mechanism क्या है? They binds to a microtubule and prevent its polymerization and assembling into the microtubules. They cause the disruption of mitotic spindle and interfere with the cytoskeletal function. So they causes basically metaphase arrest. They are active in the M phase. Now in case of vincristin, vincristin is also known as a oncovin. Vincristin को oncovin बोलते हैं. उसका use क्या है? It is used in the acute myeloid leukemia, Hodgkin's disease, Wilms tumor, then Ewing's sarcoma, lung cancer and brain cancer. Right? Now उसका adverse effect क्या होगा? What are the adverse? Alopecia, peripheral neuropathy, postural hypotension, paralytic ileus, then bone marrow suppression and syndrome inappropriate aldosterone secretion. These are the adverse effects. Now vinblastine, so it is again used in the Hodgkin's disease, Kaposi sarcoma, then lymphatic breast and testicular cancer. उसका adverse effect भी similar to vincristin है, less adverse effect than vincristin, less severe adverse effect than vincristin. Again syndrome inappropriate aldosterone and other adverse drug reaction which are less as compared to vincristin. मतलब vincristin के adverse effect भी vincristin में है लेकिन कम है उसमें, ठीक है, prevalence. Now levin, vinorlevin, so it is a semi-synthetic vinblastine analog. ये vinblastine का ही analog है, semi-synthetic, used in the first line. Okay, it is a second line drug for breast and ovarian cancer. So again dose limited toxicity इसका neutropenia and other adverse reaction are thrombocytopenia and neurotoxicity. Now taxanes में paclitaxel and other. So they are the diterpene obtained from western yew tree. Paclitaxel, docetaxel, jotroxel. They are obtained from western yew tree. They are nothing but the diterpene obtained from western yew tree. They binds to tubulin, increases the polymerization of microtubule and causes the stabilization of that microtubule. And finally, depolymerization is prevented. Mechanism is exactly opposite to your Vinca. Mechanism is exactly opposite to your Vinca alkaloids or Vinca. Next one is nothing but the paclitaxel. It is also used in the ovarian cancer and breast cancer, used in the advanced neck cancer. So adverse effects are the myelosuppression, nausea, chest pain, arthralgia, myalgia, stalking, glow, neuropathy. Docetaxel, similar mechanism like above, same like above, but additional adverse effects are arrhythmia and decrease in the blood pressure. Right? Now istamastine क्या है? It is a complex of estradiol plus normastine. Selectively gets concentrated into prostate gland and therefore ये prostate cancer में use किया जाता है. Obviously इसमें estradiol है, so that will be hydrolyzed, that will be released. So adverse effect उसका क्या होगा? Relate to estradiol. So myelosuppression is the common, gynecomastia, angioedema and hypersensitivity. Then etoposide, they are nothing but a semi-synthetic derivative of podophylotoxin. Semi-synthetic derivative of podophylotoxin, and they can cause arrest of the cell in G2 phase. They causes the DNA breaks and inhibition of topoisomerase second. So etoposide जो है वो topoisomerase second को inhibit करता है. They are used in the testicular cancer, lung cancer, Hodgkin's disease and other lymphoma. Now topotecan and irido, so they are nothing but the topoisomerase 1 inhibitor used in the small cell lung cancer. उसका adverse effect होगा क्या? Phototoxicity and bone marrow suppression. Irinotecan B, it is a decarboxylated active metabolite. उसका active metabolite कौन है? SN38. Okay, used in the कोलोरेक्टल कार्सिनोमा ऑफ लंग्स, सर्विक्स एंड ओवरी. सो अगेन इसका डोज लिमिटिंग टॉक्सिसिटी होता है डायरिया, देन न्यूट्रोपेनिया, थ्रोम्बोसाइटोपेनिया एंड हेमोरेज. नाउ विल सी द again anti-cancer antibiotic. In that you have actinomycin D. So it is a peptide antibiotic used for Wilms-Tumor, Ewing sarcoma. It will block the RNA transcription and also causes the single strand break in the DNA. Adverse effect क्या है? Vomiting, diarrhea, bone marrow suppression, alopecia. Doxorubicin, doxorubicin, they are anthracycline antibiotics. Cause intercalation between DNA strand and blocks the DNA and RNA synthesis. Toxicity क्या है? एंटी कैंसर एंटीबायोटिक का एक टॉक्सिसिटी होता है कार्डियोटॉक्सिसिटी. दे आर कार्डियोटॉक्सिक, दे आर कैंसर ऑन्कोजेन, दे आर कार्सिनोजेनिक इन नेचर, दे कैन कॉज कंजेस्टिव कार्डियक फेल्योर, कार्डियोमायोपैथी, एलोपेसिया एंड बोन मैरो सप्रेशन. राइट. नाउ नेक्स्ट आता है मिटोजेंट्रॉन सिमिलर टू योर एक्टिनोमाइसिन डी बट लेस कार्डियोटॉक्सिक. लियोमाइसिन जो एंटीबायोटिक है दैट इज अ ग्लाइकोपेप्टाइड एंटीबायोटिक and that can cause chelation of copper and iron. After chelation, it produces the superoxide ions which intercalate the between DNA strand. तो DNA को डैमेज करता है which is irreversible. Used in the testicular cancer. Now उसका एडवर्स इफेक्ट होता है pulmonary fibrosis, bone marrow suppression and mucocutaneous toxicity. Now we'll see the another important points. So cyclophosphamide क्या करता है? Hemorrhagic cystitis करता है, stomatitis करता है. Bone marrow, these are the main adverse effects. So main adverse effect of your cyclophosphamide is cystitis and stomatitis. So particularly hemorrhagic cystitis prevented by mesna. उसके additional adverse effect क्या है? Bone marrow suppression, alopecia, vomiting, amenorrhea, teratogenicity. So busulfan, it can cause pulmonary fibrosis and stomatitis. They are the main adverse effect. Now other adverse effects are bone marrow suppression, alopecia, vomiting, amenorrhea, teratogenicity, etc. Cisplatin का main adverse effect होता है ototoxicity. It also can cause renal dysfunction. Amiprostine is a drug used in the renal dysfunction or renal toxicity caused by cisplatin. Bleomycin करता है pulmonary fibrosis, edema of hand and foot syndrome. Doxorubicin, they are cardiotoxic in nature. They can cause red coloration in urine. Doxorubicin red coloration करता है urine में. Again bone marrow suppression, alopecia, they are the other adverse. Mithramycin, they can cause hepatotoxicity. Thrombocytopenia is the another adverse. Vincristine, neurotoxicity is the main adverse effect. Peripheral neurotoxicity, mental depression. Again, it can cause alopecia and muscle weakness, bone marrow suppression. Aspergillus का adverse effect होता है pancreatitis, hepatotoxicity. It can cause allergic reaction. Methadone का adverse effect होता है dermatitis, mental depression, and it can cause diarrhea also. It can cause diarrhea. You can order this magic bullet for GPAT Niper DI Pharmacist, read twice and qualify 100%. You can order this from my number. You can see we have very much promising results. Thousands of students they are placed in the Niper. You can also join our online GPAT Niper 2024-25 course. Live lecture, recorded lecture, subject wise, chapter wise session will be there. Study material in the hard copy. Online test is also available. Everything is there in 8,000 rupees only. If you get all India rank below 20, your fees will be returned in the form of reward.
Hello students, order the magic bullet for GPAT Niper Drug Inspector, read twice and qualify 100%.